Hello, future nurses and doctors. My name is Mr. Skeleton, and I am the internal steel framework, protective vault, and movement lever system of your entire body. If you look at me as a whole, I am made of 206 distinct bones in an adult, all bound together by a complex network of ligaments, tendons, and cartilage. In your nursing courses, especially when you are performing a physical assessment or managing a patient with immobility, you will hear my structures described using root words like osteo or arthro, like osteoporosis, osteoarthritis, or arthroplasty. If you see those terms, it's all about me. While people often think of bones as dry, dead rocks, I am actually a highly dynamic, living organ system packed with blood vessels and nerves, constantly remodeling myself to support your weight and protect your vital organs. The structural breakdown, axial versus appendicular. To pass your musculoskeletal assessments, you must understand that my 206 bones are split into two major geographic divisions, the axial skeleton and the appendicular skeleton. 1. The axial skeleton, the core central axis. This is the central axis of the body consisting of 80 bones. Its primary mission is protection, acting like a heavy-duty armor vault for your most vital internal organs. The skull, cranium, the solid helmet protecting Mr. Brain. The vertebral column, spine. A flexible chain of 26 vertebrae that surrounds and shields the delicate spinal cord, while bearing the weight of the upper body. The thoracic cage, ribs, and sternum. The structural cage enclosing and protecting Mr. Heart and the lungs. 2. The appendicular skeleton, the appendages of motion. This division consists of 126 bones that append to the central core. Its primary mission is locomotion, framing your limbs and allowing you to interact with the environment. The pectoral girdle and upper limbs, the clavicle and scapula anchor your arms, forearms, wrists, and fingers, maximizing your range of motion. The pelvic girdle and lower limbs, the heavy coxal hip bones anchor your thighs, legs, ankles, and toes, built structurally for weight-bearing stability and movement. The major functions of the skeleton. For your comprehensive exams, you can summarize my daily physiological responsibilities into 5 vital areas: support, protection, movement, mineral storage, and blood cell production. 1. Support and structural framework. I provide the rigid internal scaffolding that keeps the human body upright against gravity. Without me, your patient would just be a shapeless lump of soft muscles and internal organs collapsed on the floor. 2. Protection of vital organs. As mentioned above, my hard, calcified bone structures form protective enclosures around delicate soft tissues. Your skull shields the brain, your ribs shield the cardiopulmonary system, and your vertebrae shield the central nervous pathways. 3. Levers for movement. Bones do not move by themselves. However, they act as rigid levers. Your skeletal muscles attach firmly to my bones via tough cords called tendons. When a muscle contracts, it pulls on the bone lever, rotating it across a joint to produce smooth, coordinated movement. 4. Mineral storage warehouse. I act as the body's primary bank account for vital minerals. I store 99% of the body's calcium and 85% of its phosphorus. The homeostatic balance. If your patient's dietary calcium drops and their blood calcium levels run low, the parathyroid gland secretes hormone triggers that tell my cells to dissolve a bit of bone matrix, releasing calcium back into the blood to keep the heart beating and muscles firing normally. 5. Blood cell production, hematopoiesis. This is an absolute favorite topic for nursing exams. Deep inside the hollow cavities of my long bones, like the femur and humerus, and flat bones, like the pelvis and sternum, sits a specialized tissue called red bone marrow. This marrow is the ultimate biological factory where hematopoiesis takes place, the production of all red blood cells, white blood cells, and platelets. The living cells. Who builds the bone? Bone tissue, osseous tissue, is a living matrix made of tough collagen fibers for flexibility, hardened by crystals of calcium phosphate for strength. This living matrix is managed by 3 specialized types of bone cells that you must memorize. Osteoblasts, the builders. These cells are the construction workers. They secrete the organic collagen matrix and pull calcium from the blood to build and deposit fresh, hard bone tissue. Osteocytes, the maintainers. Once an osteoblast gets completely surrounded by its own hardened matrix, it matures into an osteocyte. These cells sit quietly inside microscopic pockets, monitoring bone stress and maintaining the health of the local tissue. Osteoclasts, the crushers, chewers, these are massive, multinucleated cells that do the exact opposite of osteoblasts. They secrete acids and enzymes to dissolve and break down bone matrix, releasing calcium back into the bloodstream, the remodeling balance. In a healthy adult, osteoblasts and osteoclasts work in a perfect, continuous cycle. Your skeleton completely replaces itself about every 10 years. However, if osteoclasts chew up bone faster than osteoblasts can rebuild it, the bones become porous, brittle, and weak. A major condition known as osteoporosis. Common skeletal diseases and pathologies. When mineral balances fail or the bone remodeling cycle is disrupted, it creates significant mobility issues for your patients. 1. Osteoporosis, the porous bone crisis. A metabolic bone disease characterized by low bone density and structural deterioration. As women age and go through menopause, their estrogen levels drop. Because estrogen normally restrains osteoclasts, a drop in estrogen causes osteoclasts to go into overdrive, chewing up bone matrix rapidly. The nursing consequence: the bones become incredibly fragile. The patient is at an extreme risk for pathological fractures, where a simple fall from a standing position or even just stepping off a curb can cause a hip, wrist, or vertebral fracture. 2. Osteoarthritis, OA, wear and tear arthritis. Where two bones meet, their ends are capped with a smooth, slippery layer of hyaline cartilage to prevent them from grinding together. In osteoarthritis, years of mechanical stress and wear and tear completely degrade this cartilage cap. What happens? The protective cushion disappears, leading to painful bone-on-bone friction inside the joint. It primarily strikes large, weight-bearing joints like the knees and hips, causing morning stiffness and localized pain that worsens with activity. Image comparing a healthy joint with smooth cartilage to a joint affected by osteoarthritis showing worn cartilage and bone spurs. Critical nursing assessments and implications. The fractured hip presentation. When an elderly patient with osteoporosis falls and fractures the neck of their femur, your visual nursing assessment will reveal a classic textbook presentation. The affected leg will look distinctly shortened and externally rotated, turned outward, compared to the healthy leg due to the intense muscle spasms pulling on the broken bone lever. The neurovascular assessment. The 5 Ps. Anytime a patient has a fracture or has a tight fiberglass cast applied to a limb, you must perform regular neurovascular checks downstream to ensure the swelling hasn't compressed the local nerves and blood vessels. Always assess the 5 Ps. 1. Pain. Is it out of control or worsening? 2. Pulses. Can you feel the distal pulses like the pedal pulse? 3. Pallor. Is the extremity pale or cold to the touch? 4. Paresthesia. Does the patient feel pins and needles or numbness? 5. Paralysis. Can the patient still wiggle their fingers or toes? Immobility and marodynamics. When a patient is placed on prolonged absolute bed rest due to a skeletal injury, the lack of mechanical weight-bearing stress tells the osteoblasts to slow down, while osteoclasts keep chewing. Calcium leaks out of the bones and floods the bloodstream, putting the immobile patient at a high risk for developing hypercalcemia and painful kidney stones. Encourage early mobility and passive range of motion exercises whenever safely possible. Follow, like, comment, and share if you enjoyed the lesson.